Good morning, everyone. This is Dr. Celise, your MG for today. I'm so sorry. My camera is not working right now, but I guess we have to start. I'll just fix this later while we're having your Quizmaster session. But welcome. Today is our Quizmaster for sorry. All right. Today is our Quizmaster. And I guess I'm going to show you the slide first.
Dr. Celise, good morning. Good morning to everyone. Celise, kindly turn off the alarm for people entering the Zoom
Yes,
room
Doc.
at masakit sa tenga.
Okay pa, Doc. There. All right. Good morning, everyone. I hope you had a wonderful week and blessed Sunday to all of you as well. For today, let's first start our Quizmaster first, and then make sure that you have your papers with you so we can answer them one by one. And for my section later, we will have a poll for this. Okay, I guess we can start. Number 1. Number 2. Number 3. Number 4. Number 5. Number 6. Number 7. Number 8. Number 9. And number 10. All right, that's the end of the 10-item Quizmaster. But before we proceed to our explanations and our discussion, let me introduce to you guys our Quizmaster for today, Dr. Christian Cosme. Good morning po, Doc.
Good morning, Dr. Solis. Good morning, doctors. Okay.
Doc Broly, do you have anything to say po before we proceed for the discussion?
Doc Christian, please do your very best for our students. Explain well after each item, the reason kung bakit tama yung sagot, the reasons kung bakit incorrect yung mga other remaining choices. Okay?
Okay.
Provide mnemonics, provide tips on how to approach that particular question. Show them your mindset and how you attack the question, especially for those that requires analysis. Kindly stick to the time as much as possible because they still need to study. Okay, yun lang. Ingat,
Thank you.
Doc. Thank you so
Thank
much.
you po. Thank you, Doc Broly. Okay, Dr. Cosme, you have the floor.
Hey, good morning, everyone. Let's proceed with question number 1. Okay. So in question number 1, which of the following cells produce histamine in response to acute inflammation? Okay.
Reminding my class, you have 10 seconds to answer the poll.
Okay. So majority, 67% answered letter D. Then it's followed by letter A, 25%. Okay. So in this question, this is very direct, di ba? Parang nakapanghinayang pag nagkamali ka. So we want to rule out kung ano ba yung probably hindi sagot. Okay. Platelets, isipin nyo, rule out to agad. Kasi platelets are involved in hemostasis, right? Neutrophils, isipin nyo, alis din to. Kasi increase to kapag bacterial infection, right? Lymphocytes then you would eliminate to kasi they secrete antibodies or cytokines. So you're left with eosinophils kasi eosinophils are associated with allergy, right? And so is histamine. Pero surprisingly, yung answer is platelets. Platelets yung answer, okay? Okay. So in this table, you could see that histamine comes from the mast cells and the basophils pala, not the eosinophils. And also, take note, the platelets. Okay? And you all know that histamine causes vasodilation, increased vascular permeability, and endothelial activation. Okay? So yung eosinophils actually release major basic protein, not histamine. Okay? So in this table, this came from Robbins. Ang daming information, right? So this is the type of table that I would scan or look into before the board exam, meaning days or even hours before the board exam. Kasi sobrang daming info na nakalagay dito, right? So pwedeng gawin niyo yung strategy kapag malapit na yung boards. Okay. Okay. So let's answer some question. What vasoactive amine causes vasoconstriction? It's serotonin. Okay? Serotonin, diba? Serotonin, like you're closing the blood vessel. Okay. Arachidonic acid metabolite causing both vasoconstriction and platelet aggregation. So this question also came out the board exam. They like asking about the chemical mediators. Okay, this is thromboxane A2. Okay, so what's the complete opposite naman of thromboxane A2 that causes vasodilation and inhibit platelet aggregation? Okay, this is prostacyclin or PGI2. Very specific PGI2. Okay, ito next. Complement deficiency associated with Neisseria infections. Okay, this also came out during our board exam. This is a recall question. Okay, it's C5b or C6 to C9 membrane attack complex. Okay, so lead complements yung affected or involved sa Neisseria infections. Okay, so here, all of this table came from Robbins. Okay, so para mas mapadali yung pag-memorize nito, remember that all prostaglandins are vasodilators. So you need to generalize stuff for you to remember it more, right? Okay. All prostaglandins cause vasodilation. Whereas all of your leukotrienes, they cause vasoconstriction and increased vascular permeability. Okay. But there's an exception, it's leukotriene B4. Kasi leukotriene B4 is involved in chemotaxis and leukocyte adhesion. Okay? Always remember leukotriene B4. Okay. The table on the right naman are the diseases that are caused by inflammatory reactions. So they also got question from this. Okay. The question was, which of the following diseases do not involve neutrophils? And the choices were ARDS, glomerulonephritis, septic shock, and abscess. Okay. From there, ako pinili ko personally was glomerulonephritis. Kasi pag isipin mo, pag sepsis, septic shock, di ba? There's neutrophils kasi bacterial infection infecting the bloodstream, right? Pero, surprisingly, the answer is septic shock kasi cytokines yung involved na molecules in this disease. Okay? So I just want you to know that before the board exam, kailangan nyo i-scan yung table sa Robbins. Okay? If you have time. Okay, number 2. All of the following cardiac structures are primarily affected in carcinoid syndrome except P. So medyo hati yung answers nyo. Majority answered letter D, pulmonic valve, followed by letter B, 30%, followed by letter A, 23%, to C, 11%. Okay. So nung nakita ko itong question na ito, actually di ko alam kasi di ba parang hindi mo na masyadong tinuturo sa atin yung carcinoid syndrome. Pero by testmanship, may 2 options kayo. Okay? Pwedeng ang answer is endocardium, except endocardium. Okay? Kasi all of the other choices are heart valves, right? They are valves. Pero may isa pong other option. Kasi it's very obvious if endocardium would be your answer, right? Parang giveaway naman to masyado. So isipin mo, ano bang common sa endocardium, sa tricuspid valve, and pulmonic valve? So these structures can be seen in the right side of your heart, right? Itong endocardium, for example, right endocardium of the right ventricle, okay? So you're left with mitral valve, okay? Kasi yung mitral valve is located in the left side of your heart. And the answer is actually mitral valve letter A. So bakit ba ganun? Bakit mitral valve yung hindi affected or less affected kapag may carcinoid syndrome ka? Okay. Remember that carcinoid tumors are most commonly located in your GI tract, di ba? In your GI tract. Okay. And these tumors secrete serotonin or ito yung 5-HT. Okay. And the blood supply or the blood drainage of your intestines would go directly, di ba, into your liver. Okay. And the tumor may metastasize sa liver natin. Okay. Some of serotonin may be inactivated to 5-hydroxyindole acetic acid. Pero kapag sobrang dami ng tumor sa liver or sobrang daming secreted na serotonin, it may bypass the metabolism of the liver. It would go directly into the right side of the heart, right? The right ventricle, the right atrium, tapos nandiyan na rin yung tricuspid valve and the pulmonic valve. So sila yung unang naapektuhan ng serotonin mo. Yung left side of the heart, it is less likely affected kasi serotonin gets inactivated in your lungs into 5-hydroxyindole acetic acid. Okay, this is an active metabolite of your serotonin. Pero there are some instances that the left side of the heart can be affected. Okay, for example, if the tumor is located in your lungs or in the bronchopulmonary area. Okay, pwede rin kapag there's a shunt connecting the right and left side of the heart, right? Okay, for example, may VSD ka dyan. Serotonin may travel from the right side of the heart to the left side of the heart. Okay? Tapos, pwede rin magka-left-sided carcinoid heart disease kapag sobrang high na ng burden ng disease. Okay? Kapag sobrang dami or kalatan ng tumor. Okay. So, ano ba yung carcinoid syndrome? Diba? It's a constellation of symptoms ng flushing, hypotension, take note, hypotension. Tinanong kasi sa boards namin, like, which of the following clinical features are not associated with carcinoid syndrome? And one of the choices were hypertension. So dapat pala, it's hypotension. Okay, it's hypotension. Okay. Other symptoms, abdominal pain, diarrhea, bronchospasm. Kasi di ba differential din natin carcinoid syndrome kapag asthma. And also, very specific, right-sided valvular disease. Okay? Next. Bioactive compounds that correlate with the severity of cardiac lesions. Okay? It's serotonin, pati 5-hydroxyindole acetic acid. Take note, serotonin yung active, yung inactive yung 5-hydroxyindole acetic acid. Okay. Typical cardiac lesions in carcinoid heart disease, it's tricuspid insufficiency and pulmonary stenosis. Take note of this. Okay. Most common tumor of the appendix. Surprisingly, hindi siya adenocarcinoma, but it's carcinoid tumor. Okay, it's carcinoid tumor. Okay. Lung tumor producing the so-called collar button lesion. Familiar? This is carcinoid tumor as well, di ba? Carcinoid tumor. Okay. So since we're talking about tumors na rin and the carcinoid tumor, we're talking about tumors in the heart na rin. Most common primary tumor of the adult heart, it's myxoma. Kapag pediatric, kapag bata, ang most common primary tumor is your rhabdomyoma. Okay? It's rhabdomyoma. Okay? Okay, number 3. Okay. So majority answered letter B, bilateral interstitial infiltrates. Okay. This question also came out during our boards. Okay. So you can have some clues here sa question. Okay. Una, the woman failed to get a flu shot daw. So hindi siya kapag-flu vaccine. Tapos, she became ill as many people in her community did. So, isipin nyo, pwedeng infectious or contagious disease to. Okay? Tapos, she had fever, non-productive cough, mild chest pain, myalgias, and headache. So this is very typical of viral infection, particularly viral pneumonia, right? But the question is, anong chest radiograph finding daw yung makita natin sa patient? Okay. Majority of you answered letter B, and it's the correct answer. Okay? Kasi yung letter A, you would see hilar lymphadenopathy kapag TB or fungal infection. Lobar consolidation, diba? Bacterial yan. Tapos, yung pleural thickening, pwede siyang inflammatory, infectious, pero kapag it's very extensive, you would see this in asbestosis and malignant mesothelioma. Okay. So bakit ba interstitial yung infiltrate sa viral pneumonia na makita niya sa x-ray? Kasi histologically, ganito yung kapag viral pneumonia. The infiltrates are located in the alveolar septa or the interstitium of the lungs. Okay. And majority of the infiltrates are the mononuclear, such as your lymphocytes and monocytes. As compared to bacterial pneumonia, the inflammation is located inside the alveoli. So it's intraalveolar. And you all know this, that the infiltrates are neutrophils. Okay? Okay. So you have two patterns of bacterial pneumonia. Pwedeng patchy. So it's called as bronchopneumonia. Kapag patchy yung consolidation, it's called as bronchopneumonia. Pero if the consolidation involves an entire lobe, it's lobar pneumonia. Okay? Okay. So what is the most common cause of community-acquired pneumonia? Okay? It's strep pneumonia. Okay? Most common bacterial cause of acute exacerbations of COPD. So this came from Robinson. Okay? It's H. influenzae. It's H. influenzae. Okay? Important cause of secondary bacterial pneumonia following viral respiratory illnesses. And this organism is also associated with IV drug users, lung abscess, and empyema. Okay? This is very classic of Staph aureus. Staph aureus. Okay? Most frequent cause of gram-negative bacterial pneumonia, pwede nyo rin i-add dito yung common siya sa alcoholics, diabetics, pati mucoid yung sputum. It's Klebsiella pneumoniae. Okay? Associated with cystic fibrosis, immunocompromised, and neutropenic patients. Okay, isa lang yung sagot dyan. It's Pseudomonas aeruginosa. Okay. Next question. Okay, so medyo distributed yung answers nyo. Okay. 38% answered letter D, 27 letter A, 27% letter A, followed by letter C, 19%, to 16% yung letter B. Okay. So pag ganito yung question, hanapin niyo muna yung salient features. So meron kang hydrothorax, the patient has hydrothorax or pleural effusion. Tapos meron ka ring ascites. Okay. On ultrasound, there's an adnexal mass daw. And you need to identify first, anong syndrome ba to? Okay, you have the triad of hydrothorax, ascites, and an adnexal mass. So this is Meigs syndrome. This is Meigs syndrome. Okay, and the tumor that's most commonly associated with this is actually letter D, fibroma. It's fibroma. Okay. Okay. So this is the triad of Meigs syndrome. You have fibroma, ascites, and pleural effusion. Actually, some literature say that the tumor should be a benign ovarian tumor or benign ovarian neoplasm. Okay. But on Robbins, nakalagay, 90% of the tumor, it's fibroma and 10% is thecoma. So if you're faced with the choices fibroma and thecoma, always choose fibroma. Okay? Fibroma. Okay. So nagkakaroon ka ng fluid buildup because the tumor irritates the peritoneal and the pleural surfaces. Kaya nagkakaroon ka ng ascites and pleural effusion. Okay? Okay. So here's a table that I did to summarize yung ovarian tumors. Kasi for sure, I'm sure na maglalabas na naman sila ng questions about ovarian tumors. Okay? Kapag epithelial, nandiyan yung serous, mucinous, endometrioid, clear cell, and transitional cell. Transitional cell, this is your Brenner's tumor, the Brenner tumor. Okay. Important here is that the most common malignant ovarian tumor is serous, right? The most common malignant ovarian tumor overall, it's serous. Okay. To. And the largest, this came out in our board exam also. So ano daw yung tumor na sobrang laki? It's going to be your mucinous tumor. Letter M, mucinous, malaki. Okay? Kapag sex cord stromal, you have the granulosa, fibroma, thecomas, and Sertoli Leydig cell. Okay. Want you to remember here that the most common malignant sex cord stromal tumor is the granulosa cell. Okay? Granulosa cell. Okay. Sa germ cell naman, you have teratoma, dysgerminoma, yolk sac tumor, pati choriocarcinoma. Okay. Most common overall sa germ cell tumors is your teratoma. Okay, remember this, teratoma. Pero yung most common malignant is going to be your dysgerminoma. Dysgerminoma. Okay. Kapag sa children, the most common GCT, it's your yolk sac tumor. Isipin nyo, yolk sac. So parang bata pa, parang immature. So it's the most common germ cell tumor in children. Okay. Tapos may separate classification rin tayo for metastatic tumors. Pero the most common metastatic tumors are those from the Mullerian origin. So ano ba yung mga yun? Diba? Yung uterus, yung cervix, tas upper third of the vagina. Okay. So sila yung most common metastatic tumors to the ovary. Okay? Okay. So metastatic GI carcinoma to the ovaries with the signet ring appearance. Okay. This is going to be your Krochenberg tumor. Krochenberg tumor. So para matandaan nyo, may ring, di ba? Pag nag-ring yung telephone, ring, ring, ring. Pero yung sound niya, hindi ring, kruk, kruk, kruk. Krochenberg tumor. Okay? It's Krochenberg tumor. Okay. Next. Also known as endothermal sinus tumor. Tapos meron dyan, pathognomonic dyan, yung Schiller-Duval bodies. Okay, buzzword yan. Schiller-Duval bodies, ito yung blood vessel that is surrounded by the tumor cells. Okay, so this is your yolk sac tumor. Yolk sac tumor. Okay, para matandaan, it's like putting the yolk sac of the egg or the yolk of the egg into the chiller, or the Schiller-Duval bodies. We're putting the yolk into the chiller. Okay, next. Causes hyperestrogenism, for example, AUB, breast cancer. Tapos pathognomonic dyan, yung Cole-Exner bodies, the Cole-Exner bodies, okay? So isipin mo, anong tumor ba yung nagproproduce ng estrogen? So it's going to be your granulosa cell tumor. Granulosa cell tumor. Ito, lumabas sa boards namin, there's an adnexal mass, but the patient is presenting with AUB. So again, you're going to think of a tumor that would produce estrogen, right? So it's granulosa cell tumor. Okay? Kasi di ba kapag mataas yung estrogen mo, pwedeng magka-endometrial hyperplasia, endometrial carcinoma. Okay? Tapos, dito rin yung may coffee bean nuclei. Coffee bean nuclei sa granulosa cell tumor. So paano maalala granulosa cell tumor is Cole-Exner bodies. So it's like calling your granny. Okay? Calling your granny. Okay? Next, causes masculinization or defeminization. Okay, it's going to be your Sertoli Leydig cell tumors. Remember, these cells are responsible for producing your testosterone or your androgens. Okay, paano matandaan? Sir, di ba? Sir is lalaki. Sir, lalaki. So it would cause masculinization and defeminization. Okay. Composed of thyroid tissue and may cause hyperthyroidism. It's your struma ovary, di ba? Struma ovary. Struma ovary. Associated with pseudomyxoma peritoneae, it's mucinous tumor, mucinous, in the ovaries and the appendix. Okay. Okay. Next, ito naman yung mga serum markers that might be elevated in some ovarian tumors. Kapag CA125 pati CEA, it's going to be epithelial, right? Epithelial yan. LDH, it would assess the tumor burden load kapag dysgerminoma. Dysgerminoma. Kapag HCG, think of choriocarcinoma. Kasi, di ba pag pregnancy, merong core yun. So, it would produce HCG. Okay, HCG. And lastly, AFP or alpha-fetoprotein. This is elevated in yolk sac tumor. So, para ma-correlate nyo sila, isipin nyo yolk, di ba? Parang immature pa siya, like your fetus, right? Fetus, okay? Yolk sac, fetus, both immature. So sila yung correlated. Okay, number 5. Okay, so distributed din pa rin yung answers nyo. Both B and C, 31%. Letter A, 15%. 24%, sorry. Okay. So ito, very important, tandaan nyo talaga yung differentiation ng Crohn's disease, pati ulcerative colitis. Always remember, lagi nyo tandaan yung anong difference nilang dalawa. Okay. In this question, the answer is it's letter B. Kasi choices A, C, and D, this points to ulcerative colitis. Okay. Okay. So lagi niyong tandaan na lang para mas madali. Lahat ng mas worse, lahat ng mas weird, lahat ng worse, it's going to be your Crohn's disease. Okay? Lahat ng worse, lahat ng weird, it's going to be your Crohn's disease. For example, skip lesions, full appearance, thick, inflammation, transmural. Pero, ang intandaan nyo na lang, so ano ba yung prominent kapag ulcerative colitis or ano yung mas worse sa kanila? So it's going to be your pseudopolyp formation, okay, malignant potential, toxic megacolon as well. Okay. Tapos, ito rin, this came out during our board exam, the role of smoking. Okay. Role of smoking, increase kapag Crohn's disease. Okay. Crohn's disease. Pero nare-relieve siya kapag ulcerative colitis. Appendectomy, increases the risk kapag Crohn's disease. Opposite kapag ulcerative colitis. Okay. So this is still in line that your Crohn's disease is mas worse pa rin compared to your ulcerative colitis. So again, di ba may tatlo tayong features that you would see in ulcerative colitis na mas worse. It's going to be your pseudopolyp, the malignant potential, and toxic megacolon. Okay, ito yung patandaan ko dyan. Pseudopolyp turned malignant is more toxic. Okay, toxic megacolon. So ito yung features na worse sa ulcerative colitis. Okay, remember this. Okay, tandaan nyo lagi talaga yung difference ng Crohn's and ulcerative colitis kasi pwede siya lumabas sa patho, sa IM, sa surgery, and pwede rin sa pediatrics, okay? For sure, may lalabas the question about these two diseases. Okay, earliest lesion of Crohn's disease, it's going to be your aphthous ulcer, okay, or the singaw. Cobblestone appearance of the mucosa, it's Crohn's disease. Letter C, cobblestone, Crohn's disease. Ganito yung tsura, may cobblestone, okay? Antibodies associated with Crohn's going to be your anti-Saccharomyces cerevisiae. Okay? Kapag ulcerative colitis naman, it's going to be your P-ANCA or MPO-ANCA. Okay. Next. Okay. So majority answered letter A, followed by letter B. Letter A, 42%, letter B, 29%. So the question is, which of the following immunologic diseases is classified as antibody-mediated hypersensitivity? So this is type 2, right? Type 2. Okay. So the answer is letter C. Is letter C, rheumatic fever or RHD? Kasi yung post-rep GN, type 3 yan. Rheumatoid arthritis, it's type 4. And anaphylaxis, obviously, it's type 1. Okay. Kasi i-emphasize ko tong rheumatic fever and RHD kasi lagi nila itong tinatanong, not only in patho, but in IM and micro as well. Okay? Remember nyo yung RHD, RF. Okay? Okay. For you to remember the 4 types of hypersensitivity, ito yung mnemonic, A, B, C, D. So this corresponds to 1, 2, 3, 4. Okay. Type 1, IgE-mediated. Dito yung letter A, allergies, anaphylaxis, pati yung atopic diseases natin. Type 2, letter B, antibody-mediated. Okay. Type 3, letter C, immune complex deposition. Diba? Type 4, it's cell-mediated. Kaya, other term dito, delayed type hypersensitivity. Okay? Okay. So here, type 1 again, diba? IgE-mediated. Alam niyo na yung diseases under that. Type 2, antibody-mediated. Nandito yung rheumatic fever or your RHD. Tapos yung post-rep GN, it's actually under type 3 or immune complex, right? Type 4, cell-mediated. Important here is your PPD or your tuberculin skin test. It's a cell-mediated or delayed type of hypersensitivity. Okay. So bakit ba type 2 yung RF or RHD? Kasi 'di ba, when you get exposed to strep infection or the streptococcal antigen, you get sensitized to it and the body mounts an immune response producing an antibody. Okay. Pero yung streptococcal antigens, ginagaya niya yung antigen sa heart natin. Okay. So it's called molecular mimicry. Okay. Molecular mimicry. This is the hallmark of the pathogenesis of rheumatic fever or RHD. Okay. Okay. So which streptococcal antigen cross-reacts with cardiac myosin kaya nagkaka-RHD? It's your M protein. M protein, letter M, cardiac myosin, letter M. Okay? M protein. Okay. Histologically, ganito sa RHD. So granulomatous lesions, it's composed of lymphocytes, plasma cells, and macrophages. This is going to be your Ashkoff bodies. Your Ashkoff bodies. Okay. Tapos, meron ding macrophages with abundant cytoplasm, central round to ovoid nuclei, and slender wavy chromatin. Kaya tawag din siyang caterpillar cells. Okay, this is your Anichko cells. Your Anichko cells. Okay, so these two histologic findings are associated with RHD. Okay, remember this. Okay, number 7. Okay, so majority answered letter A, 45%, followed by letter C, 23%, tas letter B, 22%. Okay. So ang question is, anong anomaly daw yung associated with autosomal recessive PKD? So very specific, it's recessive. Okay. Ito, lumabas din to during our board exam. Okay. Diba? Parang maliit lang to na table sa handouts. Pero lumabas siya. Okay. You need to know the difference between autosomal dominant and recessive PKD. So ang answer dito is, it's letter B, hepatic fibrosis. Kasi letter A, letter C, and letter D, these anomalies are associated with autosomal dominant PKD. Okay. Okay. Kapag autosomal dominant PKD, other term dito is adulthood PKD kasi it's very prevalent kapag adults. As compared to your recessive, it's childhood PKD. Remember, recessive childhood PKD. Okay. Tapos, ang associated anomalies kapag autosomal dominant is your liver cyst or polycystic liver disease. Actually, 40% of patients na may adulthood PKD, they have polycystic liver disease. Okay. Associated with din dyan is your berry aneurysms in the brain and mitral valve prolapse. Okay. The most common cause of death, surprisingly, it's not CKD, but coronary or hypertensive heart disease. Kapag childhood PKD, tandaan nyo lagi, hepatic yung disease. Okay. Kapag nag-survive yung bata into childhood, nagkakaroon siya ng hepatic disease. Kaya yung associated clinical features, portal hypertension and splenomegaly. Okay. Okay. Pwede rin, associated anomaly kapag kapanganak is your hepatic fibrosis. Okay. So kapag autosomal recessive, isipin lagi hepatic disease. Okay. Okay, number 8. Okay. So hati yung sagot between letter D and letter C. Okay, majority answered letter D, 46. Letter C, 38%. Okay. Kapag ganito yung question, histologic finding to, right? And they always ask about the histologic finding of the diseases. Okay. So una, hatiin natin siya. The chronic inflammatory disease na meron daw focus of activated macrophages. Tapos meron ka ring histiocytes, tapos lymphocytes. Okay, this is granuloma, right? This is granuloma. Pero may special dyan. There's central zone of amorphous eosinophilic granular debris and complete loss of cellular details. So this is actually necrosis, right? Very specific caseous necrosis. So this is letter D, tuberculosis. Okay. This is letter D, tuberculosis. Okay. In a granuloma, you have caseous necrosis. Kapag TB to kapag TB, you have caseous necrosis in the center. Laging may caseous necrosis. Tapos the granuloma is formed by lymphocytes, Langerhans giant cell, di ba? Ito yung Langerhans giant cell. Don't get confused with Langerhans cell in the skin, di ba? Langerhans cell in the skin is the macrophage of the skin. Okay. Tapos, ang hallmark kapag granuloma is your epithelioid cells, the epithelioid cells, not the Langerhans giant cell. It's your epithelioid cells or the activated macrophages. Okay. Okay. So here are some diseases na mayroong granulomas. Okay. Number 1 dyan, yung tuberculosis, right? Tuberculosis. Tapos ang very special dyan is tuberculosis, meron siyang crustacean necrosis or meron siyang caseous necrosis. Okay. Gusto kong tandaan nyo rin dito sa table na to is kapag syphilis, particularly tertiary syphilis, kasi dito merong guma, yung guma. Okay. And they asked during our board exam, histologic finding ng syphilis is that merong plasma cell infiltrate or lymphoplasmacytic infiltrate. Kapag nakita niyo yun, automatically it's going to be syphilis. Okay? Plasma cell syphilis. Remember this. Okay? Tapos kapag cat scratch disease, tapos stellate daw yung granuloma. Okay? Yun, automatically cat scratch disease yun. Kapag stellate yung granuloma. Okay? Yung ibang diseases, non-cascading granulomas na sila. Okay. Number 9. Okay. Majority answered letter D, 35%, followed by letter C, 29%, letter A, 19%, tas letter B, 17%. Okay. So sa question na to, which tumor daw is associated with calcifications? Okay. Medyo vague yung question kasi all of them might undergo calcification, di ba? Any tumor can undergo calcification or dystrophic calcification. Pero isa lang dyan yung prominent na merong calcifications. Okay. It's letter A, oligodendroglioma. So this question also came out during our board exam, di ba? Nakalito siya, di mo alam kung anong sagot talaga. Pero it's going to be oligodendroglioma. Okay. Okay. Oligodendroglioma, from the term itself, it comes from your oligodendrocytes. Okay. Tapos, now, requirement na and prerequisite is to have or to establish na merong IDH1 and 1p19q code deletion. Okay. Very important to kasi requirement na to today to diagnose oligodendroglioma. Okay. Tapos, grossly, yung itsura niya gelatinous, may gray masses with cysts, hemorrhage, pati calcification. Okay? Tapos yung calcification niya, pwedeng microscopic lang. Pero pwede rin very massive yung deposition niya. Okay. Buzzword oligodendroglioma, kapag meron kang chicken wire na vascular network. Okay. Chicken wire appearance. Tapos, associated din dyan, yung fried egg appearance, right? Kasi, yung cells nila individually mukhang fried egg. Okay? So, meron kang fried egg sa loob ng chicken wire. And again, very prominent sa oligodendroglioma is your calcifications. Okay? Okay. So, most common glial tumor in childhood. Tapos, meron daw Rosenthal fibers. Ito yung corkscrew eosinophilic material. This is going to be your pilocytic astrocytoma. Okay? Pag childhood, isipin nyo, pilocytic. So, parang pilyo yung bata. Pilocytic childhood. Okay? Most common and most malignant glial tumor. Tapos meron ding serpentine pattern ng pseudopalsading necrosis. Meaning yung tumors nyo, tumor cells nakapalibot sa necrosis. It's going to be your glioblastoma multiforme. Okay. Glioblastoma multiforme. Okay. Next. Hyperostotic changes in adjacent bone. Tapos may whorled pattern ka. Tapos may samoma bodies. Okay. This is very classic of meningioma. This is meningioma. Okay? Okay, let's talk about the rosettes. Kapag homocyte rosettes, the tumor cells are surrounding the neutrophil. The neutrophil. Okay? You would see homocyte rosettes in medulloblastoma. Pati neuroblastoma. Neuroblastoma, neutrophil. Okay? Neutrophil, not neutrophil. Not neutrophil. Okay. Perivascular pseudorosette, meron kang tumor cells surrounding the blood vessel. This is your ependymoma. Your ependymoma. Okay? Next, kapag Flexner-Winter-Steiner rosette, yung tumor cells nagsasurround sa cytoplasmic processes, this is going to be seen in retinoblastoma. Okay? Retinoblastoma. Okay, next question. Okay. So majority answered letter D, 51%, followed by letter A, 21%. Okay, confusing talaga yung A and D. Pero buzzword dito, di ba, yung owl's eye appearance. So So majority answered it correctly. It's letter D, Hodgkin lymphoma. Kasi kapag Burkitt's lymphoma, ito yung starry sky appearance, diba? Starry sky appearance. Okay. And all the other choices are non-Hodgkin lymphoma, Burkitt, follicular, and DLBCL. Okay? Okay. Hodgkin lymphoma, pathognomonic dyan, yung Reed-Sternberg cells o yung binucleated na cell, diba? Dalawa yung nucleus niya, kaya mukhang owl's eye. And kapag tinanong kayo, anong virus yung associated with Hodgkin is going to be your EBV or Epstein-Barr virus. So what again are the 5 subtypes of Hodgkin, diba? Nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted, pati yung nodular lymphocyte predominant. Okay. Most common, nodular sclerosis. Okay. Best prognosis, lymphocyte rich. Okay. This common, pero siya yung worst prognosis and associated with HIV is your lymphocyte depleted. Isipin nyo na lang, depleted yung lymphocytes kapag HIV, right? You have low CD4 T cells. Okay? So it's going to be lymphocyte depleted. Okay. So ito yung comparison between Hodgkin and non-Hodgkin. Isipin nyo kapag Hodgkin, mas localized sila, mas localized, mas isolated. Kaya, only spread by contiguity yan. Tapos, the nodes are rarely involved and extranodal presentation is rare. As compared kapag non-Hodgkin, meron kang involvement of your peripheral nodes, tas non-contiguous spread, kumakalat talaga siya. Okay? Tapos, extranodal presentation is common in non-Hodgkin lymphoma. Okay? Okay. So, numerous pale tingible body macrophages, starry sky appearance, tapos EBV associated din siya. Tapos yung gene translocation niya is the MYC gene. It is your Burkitt lymphoma. Burkitt lymphoma. Okay? Most common non-Hodgkin lymphoma is your DLBCL. Remember this, DLBCL. Okay? Most common indolent lymphoma of adults. Okay, it's follicular lymphoma. Okay, non-Hodgkin lymphoma that arises from sites of chronic inflammation. So you would see this tumor, for example, kapag may chronic gastritis. Okay, it's your marginal zone lymphoma. Okay, marginal zone lymphoma. Okay, so ito, meron ka raw more than 10% plasma cells sa bone marrow. Okay, yung plasma cells ganito itsura, right? Meron kang perinuclear halo. May halo ka around the nucleus or the HOF. We call this as the HOF. Tapos, meron kang punch-out lesions sa skull. So this is very typical of your multiple myeloma, right? Multiple myeloma. And yung mnemonic natin dyan for the clinical features is CRAB. CRAB. Calcium elevation, renal involvement, anemia, and bone lytic lesions. Okay? Remember? CRAB. Okay. Light chains excreted in the urine is your Benz-Jones protein. Okay? Most common Ig elevated. Okay, letter M, multiple myeloma. Pero it's not IgM, but actually it's IgG. Okay, IgG. Okay, remember this. Okay, that ends my presentation. Thank you, guys.
Wow, thank you, Doc. That was a very high-yield Quizmaster session. Ang galing ni Doc, no, guys? Ang dami yung mga mnemonics na tinuro for you, everyone. Sige, if you have questions, please put them or send them in your chat box and to your Mother Goose as well. But for now, I think we have one question pa lang so far, Doc. Meron po dito, Doc, mag-ask lang po to clarify kasi sabi po kanina, right to left shunt na VSD po ba, Doc, sa carcinoid tumor?
Any shunts naman po or any hole that's connecting your right and left side of your heart, pwedeng magkaroon ng left-sided carcinoid heart disease. Kasi malilipat yung serotonin from the right side to the left side. Okay?
All right. Thank you, Doc. Are there any more questions, guys? I'll give you like 10 more seconds to ask. Okay. Mukhang wala na, Doc. Prepared na sila. This is already our Quizmaster naman na part 2. They're also in their mastery period already. Baka medyo marami na silang alam ngayon kaya wala na masyadong hindi
Question.
clear for them. Yeah.
Oh.
Do you have any last messages for them, Doc, before they take their board exams? Tips?
Okay, so parang 3 weeks na lang, no? Less than 3 weeks. So,
Yes.
you need to focus more on your weaknesses at this point, di ba? Parang kapag magaling na kayo sa subject na yun, huwag na kayo masyado ma-stress doon. Focus on your weaknesses. And sometimes kung for you, it actually depends. Kasi ako noon, nagre-read talaga ako ng handouts kasi I want to cover a lot of information. Okay. Pero option nyo also is to do answer test, to do practice test, sorry. Kasi in doing
Yes.
practice test, you get to assess saan ka ba talaga mahina or saan yung kailangan mo mag-focus. Okay. With that, pwede ka rin mag-recalibrate kung paano magiging atake mo sa pag-aaral, di ba? Pwedeng mag-focus ka lang on this part. Tapos, tsaka mo na aralin yung ibang information kapag marami ka pang time. Okay? Tapos wag na kayo mag-check ng ibang references, only focus sa top-notch na references kasi nakakalito kapag sobrang daming binabasa. Tapos hindi niyo na ma-master. Okay? Always focus on one reference. Okay?
Yes, that is
Very good
true.
work, Christian. Refresh my mind, refresh my memory. Ikaw ba yung nagpapato residency right now? Iba pa?
Yes po, Doc.
Kaya sabi ko na nga ba, no math, kaya pala sobrang galing. Okay, are you going to be the one to give the buzzwords ba for... Sorry, nakalimutan ko yung lineup, wala yung listahan sa akin.
Hindi po, Doc, hindi po.
Okay,
Pero
sige.
last March ako po yung nag-buzzwords.
Nag-buzzwords. Okay, very good work, Doc. Okay? Baka yan na kita, paganahin kita for the Genesis and for top-notch online mga main lectures na rin. Maraming salamat, Christian. Okay, thank you so much, Celis.
Thank
Okay.
you, everyone.
Happy Sunday, everyone.
Happy Sunday, everyone. For my section, please stay in the Zoom meeting. While we end this, I will just play one last video before we go offline. Happy Sunday, everyone.
You can be the greatest, you can be the best, you can be the King Kong banging on your chest. You can beat the world, you can beat the war, you can talk to God, go banging on his door. You can throw your hands up, you can beat the clock, you can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame. And the world's gonna know your name. You burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame.
Yeah, you can go the distance, you can run the mile, you can walk straight through hell with a smile. You could be a hero, you could get the gold, breaking all the records you thought could never be broke.
Do it for your people, do it for your pride. How you ever gonna know if you never even try? Do it for your country, do it for your name, cause there's gonna be a day when you're
standing in a Hall of Fame, and the world's gonna know your name, cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of
You can
Fame.
be a champion, you can be a champion, you can be a champion, you can be a
You'll be on the walls of the
champion.
Hall of Fame.
past failures may haunt you. You yourself may doubt you, but don't let none of it discourage you and stop you, block you from reaching your goals. Just believe in your own capability, ability to aim for the stars. You will overcome this war. You'll be licensed to heal and be licensed to help. This is for your mama and this is for your papa. Know that pain is temporary, but your license
Standing in a Hall of Fame, and the world's gonna know your name, cause you burn with the brightest flame, and the world's gonna know your name, and you'll be on the walls of the Hall of Fame. You could be the greatest, you could be the best, you could be the King Kong banging on his his chest. You could beat the world, you could beat the war. You could talk to God, go banging on his door. You can throw your hands up, you could beat the clock. You can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and gonna find yourself standing in a hall of fame.
All right, that is it for our Patho Quizmaster session. Enjoy the rest of the 3 days of your pathology, and we will meet you guys on Wednesday for our biochemistry Quizmaster session. Have fun, everyone. Bye.